NExT exam is just like eating this chocolate. Each bite is a subject. It goes into the mouth and its various contents mix and gives the lovely chocolate taste. If you haven't guessed it already, the secret to success in this exam is mixing. That is the horizontal and vertical integration. To look at the patient as a whole, to diagnose and treat as a whole. That's the whole essence of becoming a doctor, isn't it? Now what is this NExT exam? Is it confirmed for 18 batch? What is the pattern? Preparation strategy? I'll try to answer all these questions and more. We are all in MBBS. So we are going to become doctors for sure. So why not become the best doctors in the field of our choice? For that, we need to crack this exam. What is NExT? National Exit Test will be a common exam that will be mandatory for Indian as well as foreign medical graduates. According to the draft by National Medical Commission and a tweet by Dr. Mansukh Mandaviya, who is the Minister of Health and Family Welfare, NExT exam is scheduled in 2023 and its mock exam, which is basically like a practice test, is supposed to happen later this year in 2022. Considering all the dates, it's pretty obvious that 18 batch will give this exam for sure. National Exit Test will be a single exam that will replace NEET PG, AIIMS, PGI, JIPMER, NIMHANS, FMGE. With this, you can guess the difficulty of the exam altogether. It will be in two phases, NExT 1 and NExT 2. NExT 1 will be an MCQ type entrance exam for PG that will give you the rank. This rank will be used to allot your postgraduate seats in MD, MS, DNB or diploma in both government and private medical colleges throughout India. NExT 2 will be more of a practical based pass or fail type exam that will give you your MBBS degree. Pattern of exam. NExT phase 1 will be the exam that will determine your rank. So let's talk about it first. It will be an MCQ exam mainly from clinical subjects. All 19 subjects are included, but the subject-wise marks distribution varies greatly. First and second year subjects have a collective weightage of just 10%. But don't get fooled by it. We will talk about it later in the video. So 90% questions will be from clinical subjects. According to the draft, there will be 540 questions in NExT. 10% from first and second year, 10% from PSM, that is preventive and social medicine, and rest from the rest of the subjects. This exam will be held over 3 days. Each day will have a pre-lunch and post-lunch session. Ophthalmology, ENT and pediatrics will have their own separate question papers of 60 questions each. Now let's talk about the timeline for this exam. You enter into MBBS, you pass all the university exams and enter into the final year. Now you will have to give the NExT 1 exam. What about the final year university exam? I currently have no idea about it. Now let's say you pass the NExT 1 exam with flying colors. Great, you will do your internship and choose your branch and college for PG. What if you pass NExT 1 but can't get the desired rank? You will be able to do the internship and then attempt the NExT 1 exam once again next year. What if you fail NExT 1 exam? 1 year wasted. You cannot do anything. Wait for the exam next year. Now after finishing internship, you will be giving NExT phase 2 exam, which is a pass or fail type exam. If you pass, congratulations, you are finally MBBS doctor. Now go join your PG or repeat the NExT one for better rank. Your choice. If you fail, boy, no MBBS degree, no license to practice in India. Wait for 1 year and try again. Moving ahead, let's talk about dates. According to the draft, mock test will be later in this year in 2022. The NExT one is scheduled before 10 January 2023. But with COVID and all, I personally think that it might be a little delayed. Going with the draft, the results are supposed to be declared by the end of January. And first round of counseling will be in March. This is all the stuff I know about NExT exam at this moment. I will be posting any update that I know about on my Instagram. So make sure you follow it. Also, I will be making a lot more videos about how I am preparing for NExT. So like this video and subscribe for more so. My NExT exam preparation strategy. I am not qualified to give any advice or preparation strategy for NExT PG exam. All the ideas and things that I am sharing here are from the teachers of DAMS and other sources. No one has given the exam yet, so no one knows what the right strategy is. I don't know which option you should choose. I could never advise you on that. No matter what kind of wisdom dictates you the option that you pick, no one will be tell if it is right or wrong until you arrive at some kind of outcome. The only thing that we are allowed to do is to believe that we won't regret the choice that we made. With this quote from Attack on Titan, let's start with my preparation strategy for NExT exam. We will walk through it as a timeline starting from first year. You can watch it all to know what's important, or you can skip to your respective part to save time. First year, you have just entered med school. Take your time to get adjusted. You will study 3 preclinical subjects. Although they don't have much weightage, they will definitely help you in your vertical and horizontal integration later on. We will come to that part soon. In the first year, I want you to make a strong base for every subject. You don't need to start solving MCQs right away, but you definitely should attend all the practicals and postings. Next exam is all about clinical cases. So the more patients you study, the better. You can very well join DAMS or Marrow or any other coaching classes. But I think it is not necessary as of now. In the first year, you should learn about general physical examination and various systemic examinations. That is a must. With a strong base and knowledge about the clinical examination of a patient, we can move ahead. Second year. It's high time now. Go join some classes for the next preparation. Start watching the first year videos if you haven't already. Simultaneously, go and finish the second year videos as well. It will be wiser if you start preparing notes for your PG exams. These notes will help you in your revisions later. Pharmacology, pathology and microbiology. The 3 paraclinical subjects don't have much weightage in the next exam per se, but they form the base of all the clinical parts that you study. How? Let's consider medicine. It has normal physiology of various organ systems. Then the associated diseases which is covered in pathology and their treatment, that's pharmacology. You will notice that if you form a strong base in the first and second year, a lot of your medicine will be covered. The only part will be left will be the diagnosis and management of the patient. You can learn about that in clinical posting. Similarly, half of surgery is just anatomy, pathology and logic. That is why it is really important to form a strong base in first and second year. Now here's a catch. The next exam is going to be right after your final year. So you won't get any time in internship to study. That is why we have 1 year less. What I am going to say might come as an unpleasant surprise. Second year students, I want you to finish third year in second year itself. Don't leave the video just yet. Listen to my logic first. We are going to need 6 months for the revision of the next exam syllabus. So anyhow, we need to finish reading the whole MBBS 6 months before the exam. Final year is big, with 4 major subjects and 5 minor subjects. It is going to take as much time as you give to it. I hope you understand my logic. Start watching PSM 1 hour every day, right after you finish your second year lectures. ENT and ophthalmology are rather short. With continuous reading, you will definitely be able to get done with them in 1 week. I know second year is big. I know it sounds impossible, but I also know that you can do it. You don't have any other choice. Third year. For the third year students, if you haven't completed your first and second year lectures yet, just leave them. Give your full focus on third and final year. I want you to finish all the 3 third year subjects in 15 days. How? That's your problem. In the first and second year, it is important to read at least the important part from the standard books. Third year onwards, it is race against time. What I did in third year was I ditched the standard books. For university exams, last 10 year papers are enough to pass. I devoted all my time in third year to finish the final year subjects and do the clinical postings as much as I can. I started with short subjects, 3 to 5 days per subject. For bigger subjects like medicine, surgery, obs-gyn and peds, I tried watching 1 lecture per day. Somehow, through pits and falls, especially thanks to exams being postponed because of COVID, I'm done with all the short subjects. I'm done with pediatrics and half of each obs-gyn, medicine and surgery. Currently, I am focusing all the time of the day to finish these remaining subjects. Once I finish it, I will do the question banks from all subjects starting from third year. But that is a part for later. I plan to start giving grand tests after university exams. As you can see, a lot of my strategy and preparation from now on focuses on finishing the lectures and preparing the notes of all these subjects. Once I'm done with my university exams, I will sit back and think about what to do next. So make sure you watch me in my upcoming videos. Now let's come to the last part of the video. The horizontal and vertical integration. To be honest, I haven't completely understood how to do it yet. What I know is this. We will get a clinical case scenario in which a complete patient history will be given. It may include images from radiology, data from pathology, maybe microbiology report, or clinical science, or maybe some kind of surgery in the past. That is why, let me say it again. Attending clinical postings is very important. Looking at the patient complaints and various tests, we will diagnose and manage the case and answer the questions. As you can guess, there is little scope for one-liner questions. One thing for sure, we are going to feel like we are actually looking at and treating the patient as a whole. That's what this integration is all about. I will talk more about how to integrate all the subjects after I have actually finished reading them. Please wait until then. I hope you have realized that the next exam is going to be the make and break exam for your future career as a doctor. If nothing else, it is definitely 3 days of compulsory hell. But hey, good thing is we are used to such things. 10वीं कर लो बेटा, फिर मजे ही मजे हैं. नीट कर लो बेटा, फिर मजे ही मजे हैं. MBBS कर लो बेटा, फिर मजे ही मजे हैं. अरे नेक्स्ट PG पास कर लो बेटा, फिर मजे ही मजे हैं. बेटा ये मजे वगैरह सब मोह माया है. Meaning there are going to be countless such challenges in life, one after the other. If you are always afraid of the future, you will never be able to enjoy the present. Remember, there's a fine line between enjoying your present and ruining your future. As long as you don't cross that line, you will be fine. It is time to stop waiting to experience life. Don't wait for summer to plan adventures for yourself. Don't wait for Sunday to go to that new cafe. Take pictures of your friends and glow up into your dream self. Don't wait for the perfect moment to say those kind thoughts that pop up in your head. Don't wait for that flash of inspiration to learn a new language or write the first page of your book. Don't wait for the confidence to sign up for something great that terrifies you at the same time, especially when no one else believes in you. Don't wait for the courage to confess your love or turn away from the person who makes you feel worthless. Don't wait for the weekends to do little things that make you happy. Give permission to yourself to enjoy every day and every moment, just as you are. This is Abhijeet signing out. See you in the next video and happy studying.